Hospitalizations are up across the province. Many have been calling Omicron a mild variant, but some medical experts say that clearly isn't the case considering the spike in ICU admissions.
It's quite worrisome because the rate of increase doesn't show any sign of slowing down, especially the ICU occupancy. The vast majority are unvaccinated or frail elderly people who are vaccinated.
It's the first time provincial ICU COVID-19 cases have surpassed 400 since June 14th of last year. There are currently 412 people in intensive care. 123 are unvaccinated patients and 137 are fully vaccinated. 18 are partially vaccinated.
Even though, a lot of seniors are fully vaccinated, a lot of people with multiple medical problems are fully vaccinated, they still need support in the hospital for a few days, like just IV fluids or oxygen or antibiotics. So that's what's really pushing the numbers there.
Earlier today, palliative care physician Dr. Nahi Dasani tweeted this: "Can someone please explain to me what exactly is mild about Omicron? Are the record high hospitalizations mild, the ICU admissions, the delayed surgeries, the outbreaks in shelters and long-term care? We must stop the Omicron is mild narrative. It isn't helpful." Toronto emergency physician Dr. Kashif Prasada agrees.
I think there may have been a lot of optimistic thinking. I think we were misled by the narrative that this was mild. It's mild only for the healthy and vaccinated. We have an older population. We have a large unvaccinated population. It was never going to be mild for them, and it definitely isn't now. And, even if a small percentage need admission to hospital, a small percentage of a massive number is going to be overwhelming for our system.
And what is the situation right now in hospitals? What are you seeing right now? Is staff feeling overwhelmed?
There's a lot of frustration because, a lot of the worst cases are in unvaccinated people. And this is completely preventable. And it's starting to saturate all available resources. A lot of routine care, cancer care, has been stopped because we don't have room to take care of them because of a massive wave of sick, unvaccinated people.
Do we have to worry about capacity limits right now?
It's starting to happen that way. We're not overwhelmed. It's not like what it was at the peak of the last wave, but I fear the next week or a couple of weeks it's going to be like that if the trend doesn't slow down.
Dr. Prasada says he's hopeful the worst of it will be over in the next 2 to 3 weeks, but it's difficult to say considering we aren't seeing accurate COVID-19 case numbers due to the changes when it comes to testing.